And in our next half hour, we will talk with Johnson & Johnson CEO about the company's plan to get 100 million doses by June.
Well, vaccine distribution is ramping up. There is a new worrying drop in COVID testing across the country. Right now, the U.S. averages 1.4 million tests a day. That's down from a high of 1.9 million in mid-January. Less testing could slow down our ability to track outbreaks of the virus. Our lead national correspondent, David Begnaud, is in Los Angeles. David, what's driving this decline in testing?
Well, Anthony, the main reason is they're turning testing sites into vaccine sites, and it makes sense, right? But we took a look at the data, and when you take into account Los Angeles County, where we are this morning, it appears testing is down 34% in the last month. That's a pretty sizable chunk. And what that means is people who are relying on testing sites, say monthly, to keep working, are showing up at testing sites like where we are this morning, the VA hospital in Los Angeles. Folks are showing up to see an empty parking lot, and they're thinking, hey, wait a minute, what happened?
Hairstylist Amanda Shuttleworth feels like getting tested is something that she owes her clients.
I see clients regularly, so it's my responsibility to make sure that I got regular testing.
So how regularly were you going?
I would probably say like once a month.
She had tested positive back in December, and so she wanted a follow-up test just to reassure her clients that she was virus-free. But when she went to her usual testing site,
it was gone. It was like a ghost town. There was nothing there.
Her testing site at the VA hospital parking lot in Los Angeles was closed entirely. And the city is now turning other testing sites, like Dodger Stadium, into vaccine sites. And it's happening in cities across California.
We were averaging 330,000 tests a day towards the end of December, early January, and now we're below 200,000 tests a day.
That is Dr. Mark Gayle, California's Secretary of Health and Human Services. He says with variant strains of COVID spreading across California, mass testing is as important today as it's ever been.
We can't ramp down testing too much. Otherwise, if we did see another surge, we're never going to be able to track it, and we are not out of the woods yet. The only way you track a variant is by starting with a positive test. So it's going to be key over the next weeks and months.
And you know, the upcoming vaccines could be a part of the solution. There are the new shots from Johnson & Johnson, Novavax, and AstraZeneca that can be stored in normal refrigerators in doctors' offices. And that is a game changer, says CBS News medical contributor Dr. David Begnaud.
Every year, we give flu shots, and 60+% of the country is vaccinated with an influenza vaccine. Those are done in doctors' offices and in community hospitals. We have to start to transition vaccines there so we can go back to testing at the large centers.
There are other doctors who say, listen, we need to focus more on vaccines than we do on testing. Do you agree?
Well, vaccines are what's going to get us out of this pandemic, period. At the same time, we have to figure out an alternative way to do testing. Knowing if you have or you don't have the virus is critical for your behavior. Do I quarantine? Do I stay home? You need testing to determine that.
Makes sense, right? As for our main character, Amanda Shuttleworth, she was able to find testing. She finally, after spending some time on her phone looking for a testing site, found a Rite Aid in South Los Angeles. She went through a drive-through and tested negative for the first time in nearly 3 months. If you're a mayor, county executive, or governor and you're watching this story's for you. Don't forget about testing.
Yeah, it still matters, David. Thank you very much. We appreciate it. All right.